Hello, and welcome to Precision Practice Management and our tutorial on Drag and Speak technology and creating an Encite note. On the home screen, select the Patient Flow icon on the top navigation. From the Patient Flow screen, double-click on the patient, in this case Susan, and you'll be taken to the patient's note. Select the red dragon icon and the note template will appear. You now have the option to use Dragon Naturally Speaking by clicking your cursor in the desired text box and using your microphone. Simply speak your HPI and then speak your exam.
She is afebrile with stable vital signs, period, new line. She is alert and in no distress, period. There is no wheezing or stridor, period, new line. Ears are clear, period, new line. Nose reveals some crusting of the nasal vestibules, period, new line.
The right ear is thick and dull, without acute inflammation, period. On the left side, the tube is out and lying in the canal, and there is an amber air fluid level in the middle ear space, period. The drum is thin and atelectatic.
This 44-year-old female is here today reporting that for the last 3 months she has had a tenderness in her ears, period. Right side is worse than left, period. She also is complaining of a swollen sensation in her throat, period. She reports that she has some throat tenderness that waxes and wanes, period. New paragraph. When asked specifically, she reports that she does tend to grind her teeth at night, period. She has discussed this with her dentist in the past, and a night guard was recommended, period. Patient did not follow this recommendation, period. New paragraph. She denies dyspepsia, period. New line. Tab. Tab. Physical exam reveals patient to be alert and cheerful, period. Ears look fine, period. Nose is clear, period. Oral pharynx, oral cavity clear, period. Indirect laryngoscopy reveals moderate posterior laryngeal inflammation, period. Neck is supple without lymphadenopathy or thyromegaly, period. Palpation of the TMJ on both sides reveals significant amount of crepitation as well as audible crackling and grinding, period. New paragraph. Tab. Impression. Temporal mandibular joint dysfunction with associated otalgia, period, new line. Numeral 2, period. Posterior laryngitis with associated throat discomfort, period. This is secondary to laryngopharyngeal reflux, period. New line. Tab.
You also have the option of using pre-selected buttons from the customizable list on the left-hand side. These generate your note by avoiding redundant speaking. To sign off your note and alert the secretary to send a referral letter, simply select the Sign Off button at the bottom of the screen, hit Send, and then Sign Off. Your completed referral letter is now ready for faxing.